Dan, so good to see you. A really important story today. The ACA cliff, the $1 income mistake that could cost you thousands in health insurance. One of the biggest surprises people face when retiring early has nothing to do with investments, it's healthcare. And starting this year, a little known rule under the ACA created a really shocking outcome. So take a look, everybody, at this. This showed how earning one extra dollar of income could cost you thousands. 2025 is the blue line. We had a nice gradual increase with healthcare premiums. But in 2026, the COVID era subsidies went away. And Dan, I know you know this, but that one extra dollar, all of a sudden it shoots you up into the ether. It's incredible. So what does this mean for people who need healthcare before they're eligible for Medicare?
Yeah, it means that the last thing you want to do as you're approaching retirement is get smacked in the face with a big, ugly, negative surprise.
Yes.
And so it's really going to require some proactive planning, Aaron, to make sure that there's no surprises and that you just understand the rules of the road and what you need to do to both satisfy your lifestyle, but also work within what's called your modified adjusted gross income, because that's the number that is looked at in determining what the cost of these premiums are actually going to be.
Right. So let's get into the details. But first, who gets hit the hardest?
I think someone who's trying to retire before they're Medicare eligible and the subsidies go away. So in general, it'd be retirees and anyone trying to retire early. They have to really watch out. It's a big time landmine. You don't want to step on it and then get surprised.
Right. So what can we do now then to avoid this income trap?
Aaron, there's a few things that you can do now. And I think that one is to consider HSA accounts, because HSA accounts do not count against your modified adjusted gross income. They've been around a long time. A lot of people have heard what the HSA accounts are, but if you're in this position and you're trying to manage that modified adjusted gross income so your premiums don't skyrocket, you ought to take an honest look at HSA accounts, because they're a great planning tool. The next thing I would look at is Roth conversions and getting more money. The younger you are, the sooner you can do it, getting more money into Roth conversions early and now. And I know the negative is, okay, well, I have to pay tax now that I could otherwise defer. But if you're an accredited investor, there's a lot of programs where you can get a big discount on that tax effectively by utilizing different things that are tax credits involved in oil and gas and real estate that can shelter the taxation on those Roth conversions. So it could help you maybe convert more than you were comfortable with otherwise.
Interesting. You're bringing up so many good points. What I'm hearing you say too is that it's the taxable income that really could push you over the edge with this cliff. So just to underscore for everybody listening and watching, it all comes back to proactive planning, because income isn't just about taxes anymore. This is also going to directly affect healthcare costs as well.
That's right, Aaron. And people have more control over their adjusted income than they realize, because the way you manage the portfolio, you could potentially move some money into oil and gas that has large tax credits. For example, a $100,000 investment in a drilling program could generate a $90,000 write-off right now. That could go a long way to bring your premiums down to an acceptable level. And for the right person, it might even be a real enhancement to both your income planning and the diversification, your overall integrity of your asset planning, of your asset allocation.
Yeah. As you say, it all comes back to, again, getting that plan in place now so that we're not blindsided or punched in the face. I think was what you said at the beginning. This is so important to have this conversation with somebody now. So Dan, if somebody would like to sit down with you, see what their options are, especially if they want to retire early, what's the best way to reach you?
I think, Aaron, just super easy to reach out to us at the office here, 281-466-4843. The website is Provident, Provident, ProvidentWealthLLC.com. That's the easiest way. Someone will set up a call, a meeting, and we'll help you any way we can.
So worth it. Dan, thank you for your time today.
Thanks, Aaron. Good talking to you.